Okay. Yes. Okay, so Nuradiin, you go ahead.
It's you starting us off, Bo, first slide. Go ahead and put up the slide. Shukri, share it, please.
Perfect, thank you. My apologies. What's going on here, guys? Okay, so thanks everybody for coming. Really appreciate it. We're really looking forward to sharing some of the news that about the community health hubs that we're working on. I'll start us off with an ancestral acknowledgement. This event was organized for Black Mental Health Week, which is led by the Ottawa Black Mental Health Coalition. The coalition's goal is to achieve a more equitable mental health system by improving access to culturally appropriate mental health supports and resources for Black residents. We honor the integrity of our Black ancestors and acknowledge their resilience while recognizing their contributions as to human civilization. We take this opportunity to reflect on our current condition in this country, and we'll continue to work with our allies towards improving the lives of our diverse peoples on this shared land. Merci beaucoup, asante, thank you. Thank you for being with us today. And Nuradiin, over to you.
Thank you, Bo. We want to begin. If you go to the next slide, Shukri. No, just go back one. Thank you, Bo. We want to begin our session by acknowledging that the land on which we gather in this traditional ancestor territory of the Algonquin and Anishinaabe people. The Algonquin people have lived on this land since the time immemorial. It is important to acknowledge and extend our respect to all First Nations, Inuits, Métis people for the valuable past and present contribution to this land. With this in mind, the Ottawa Black Mental Health Coalition respectfully acknowledges and appreciates our presence on Algonquin and Anishinaabe ancestral lands. We are grateful to have the opportunity to be present in this territory and here and have you here today. Miigwech. Go to the next slide. And today we go over the agenda. As you see, we will go ahead with the introductions. If I start with ourselves, I'm from Ottawa's Public Health. My name is Nuradiin Mohamud. I'm from Ottawa Public Health Mental Health and Substance Youth team. And I'm part of a team of two that lead the ACB branch. Myself and my colleague who's also here will introduce himself. And we also have Bo that you just met. He will take over from here on. We'll talk about Upstream Ottawa's background. I will then talk about OPH background and how this idea came up to have hubs, and how it will be executed. Faqrudin Ali will talk about how it will be executed and the locations, and we'll touch more. He will also speak about the partnerships, and then at the end we'll take some questions. I'll pass it back over to you, Bo.
Great. Next slide, please. And so again, my name is Bo Turpin. I'm the Executive Director of Upstream Ottawa. Our full name is Upstream Ottawa Mental Health Community Support. And I've been with the organization now for about 22 years, if I'm dating myself correctly. Next slide, please. Before I begin, look at that. Before I begin, I'd like to state that I've always held a special place in my heart for serving Black youth. From childhood, I often recall being the only person of color at social events, or one of the few Black students in school. I'm sure some people can identify with that. And in some instances, my color made it difficult to hide in the crowd. For example, if there was trouble at school, often teachers, if I was nearby, I kind of would have been drawn into the fray for whatever reasons, even if I was not involved. other instances where, you know, I also felt invisible, and that still happens today. You know, if standing in line at a, you know, to get some kind of customer service, and that the next person is not being called, though it's my turn, isn't me, which is kind of ironic at times. Anyhow, I had to struggle to find my place as a biracialized child and youth, and I fully appreciate to my core the structural barriers to wellness and that racialized youth experience. And it's one of my life's privileges to be involved in this work. So we're building a service that embraces Afrocentrism at its core and welcomes all the diaspora of Africa, regardless of where they come from. So if I take a moment to delve into the services we provide at Upstream Ottawa, our core service is intensive case management. So we've got 5 intensive case management workers or community support workers, and they provide community-based supports to those experiencing a severe and persistent mental illness and or co-occurring substance misuse, and who also have a deficit in functioning. And that's the important part, that it's causing homelessness or risk of homelessness, frequent hospitalizations, or justice involvement. Our newest service expansion is the Sophisti program, and I'll dive into that shortly. We also have a psychiatric assessment clinic that we offer in collaboration with the Royal Ottawa Hospital. And this is accessible to our community partner agencies, so community health centers, mental health agencies, schools, pretty much anybody that would be a community-based agency. And they can refer their clients for a psychiatric assessment as long as there is a referring physician involved or a nurse practitioner. We have a housing program, 14 independent units scattered around the city, that fully furnished apartments, 2 group living residences, 1 2-bedroom, and a 5-bedroom unit as well. And we have a number of activities that we titled value-added services. And these are activities that are not, we don't receive any core funding from. And so we conduct a lot of fundraising events and throughout the year and solicit donations to help drive and support these programs. Things like our First Connections monthly luncheon, which has been going on for, I think, 20-something years now, and that's in conjunction with United Church and the Canadian Mental Health Association. We have a women's group that's been going for over 15 years. Back to School, Back to Work program that makes funds available to reduce barriers to returning to school or to work. Various monthly outings and a peer-to-peer group where we give a small stipend to clients in an effort to support their social circles and you know, networking. But due to the pandemic, of course, these programs have been on hold, and you know, we're eagerly anticipating you know, starting where we left off. Hopefully that's on our soon horizon. And during the pandemic, we've had to pivot, like all other organizations, to meet the needs of our clients. And this came in the form of food programs in the early days, where we partnered with Operation Ramsey to deliver over $20,000 in food to our clients' doorsteps. We've also collaborated with Bell Let's Talk to deliver cell phones, tablets, along with data plans to our customers and also to other organizations. So that all in an effort to stay connected, because as we know, at the beginning of this pandemic, it was tough to stay connected with people, especially those below the poverty line or closer to the extreme poverty line, as we all know. And then lastly, Uber rides were used to bridge our capacity to provide transportation assistance as we discontinue driving people in our own vehicles for obvious reasons. So that's a little about what we do. Just hit the tab button there if you don't mind, Shukri. We're also part of a number of various networks. Yeah, I was playing around when I made this. I'll be perfectly honest. I was like, ooh, a really cool animation. It doesn't seem to be working all that well at the moment. So just keep hitting tab and it'll pop up at the end. There we go. So we're part of the Ottawa Black Mental Health Coalition, the Ottawa Justice Service Network. I sit on the planning committee, Mental Health Community Support Service Table. That's a consortium of ICM partner agencies providing intensive case management supports. Sit on the Supportive Housing Network and the Addictions Mental Health Ontario, and I think the Champlain network is missing there as well. It's a Champlain Health Network. So that's it for me in a nutshell. I've kept it as brief as I could. I'll hand it back over to you, Nuradiin.
All right. So if you go to slide 9, next one.
Actually, it's me again. All right, back to me in that case. So I'll talk now about our Sophisti program. That's kind of the nuts and bolts of why we're doing this work. Sophisti stands for the Substance Abuse Program for African, Canadian, Caribbean Youth. So this is the name of the program at the moment, and we recognize that the word abuse in the title needs to be updated to a more appropriate language, and these efforts are underway to retitle this program. It was just a program that had been expanded by the Minister of Health, Minister Tobolo, kind of a pet project of his, and we were lucky enough to tag on to that. So the Sophisti program started in CAMH in Toronto, and now it's being exported to 7 other sites across the province. So that's including ourselves. There's Taibu Community Health Center in Scarborough, Rexdale Community Health Center, Roots Community Services in Brampton, CAFCAN in North York, Hamilton's Urban Core Community Health Center, and Windsor Essex Community Health Center as well. So we're 7 partner sites, all trying to ensure that we can provide some Black mental health and substance abuse services, really coming from a Black lens. So Sophisti will endeavor to provide safe and affirming anti-oppressive, anti-racist, and trauma-informed mental health substance abuse services to Black youth between the ages of 12 and 29 and their families, which is just as important. And with a combination of education and lived experience, our clinicians recognize how systems of oppression overlap the silos of isms and phobias, such as racism, sexism, ableism, classism, heterosexism, homophobia, and transphobia, to adversely affect the mental health of Black youth and their communities. And collectively, we work towards decolonizing mental health supports for clients of African descent. What this expansion means for Upstream Ottawa and the community at large is the ability to provide 4 clinically competent staff from the ACB, and ACB means African Caribbean Black community, consisting of a coordinator who is hired right now, which is Ebenezer Amponsa, works with us. He's been with us for about 10 years. 2 mental health addictions social workers, and 1 case manager. And we're just in the process of ramping up this program as we speak. And our team will have the ability to provide a culturally safe and relevant support to youth who have been historically underserved and marginalized by our health system as a whole. So the service model is comprised of individual counseling and support, joint counseling with family and extended family members, group therapy, family group supports, and intensive case management. With the exception of Indigenous youth, Black youth are the most vulnerable youth segment in Canada. Therefore, supporting counseling with these youth not only includes interventions geared towards meeting their substance use goals and their clinical recovery needs, but doing so from an Afrocentric lens. You'll hear this word a few times, Afrocentric, and you'll see, oh, I thought it was Afrocentric. Well, the movement is now towards Africentrism and using Afri because Afro is a hairstyle. Africa is a continent. Further, Black youth have verbalized the importance of receiving support from ACB clinicians who understand and appreciate the ever important cultural aspects of their needs, which so often are trivialized or ignored. Our treatment goals encompass and embrace the realities of Black lives lived in a Euro-dominant culture and take into consideration all the factors that pose threats to their mental health and which so often constitute the underlying reasons for their substance misuse. Next slide, please. So I'll drill down a little bit further on some of the underpinnings and fundamentals of the Sophisti program. Bear with me for a moment. We speak about Afrocentrism. According to Wikipedia, Afrocentrism is an approach to the study of world history that focuses on the history of recent African descendants and is in some respects a response to Eurocentric attitudes about African people and their historical contributions. So contextually, if you think of this as the backlash against the whitewashing of Black history over time, which has negated and ignored the contributions of Black people. Social determinants of health, well, there are 12 of those, which include income and social protection, education, unemployment and job insecurity, working life conditions, food insecurity, housing, basic amenities, and the environment, early childhood development, social inclusion and non-discrimination, structural conflict, and access to affordable health services of decent quality. Resilient and strength-based approach is based on three principles. The resourcefulness and resilience that exists in each person. It is based on the belief that people can grow and change and that they have a range of abilities. And that acceptance that each person's solution to a perceived problem will look different. And as a result, everyone should be fully involved in identifying their own goals to build their own resources and their resilience. And that individuals live in communities and families, and whether those families are blood related or not, and a society, and we're getting there on the society aspect, that supports them in determining their aspects of well-being. Black feminist theory, this addresses the lack of culturally appropriate and trauma-informed mental health and substance use supports for Black women and girls, and thus this merits its own special consideration. Queer theory, this theory recognizes diverse gender categories, sexualities, orientations, and family structures, and challenges binary and heteronormativity's role in creating systems and realities of oppression and violence for the LGBTQ two-spirited plus communities. Harm reduction, well, we all heard this before. This is an approach to reducing drug-related harm without requiring the cessation of drug use. Structural social work, that's a big chunk of what we're doing, obviously. This seeks to dismantle colonialist, patriarchal, and capitalist structures to address social inequalities. Gender analysis. The devaluation of Black male identity in North American society has, according to Nadhari in 2009, created a Black male identity that is rooted in a trauma response. Black adolescent males are often perceived as threatening, underachieving, and hyper-masculine, which is reinforced through media outlets and psychological research that portray them as a monolith, as opposed to a heterogeneous group with multiple intersecting identities. Psychosocial treatments that we'll be undertaking are psychotherapy, psychoeducation, and group therapy. Culturally responsive CBT is psychotherapy that integrates a culturally appropriate lens into the matrix. Motivational interviewing, this is the technique, this technique and approach has the aim of supporting clients to evoke within themselves the motivation to change, identified substance use behaviors, or mental health challenges. Group family support, well, that's fairly self-evident. And then pharmacological treatment and resistance support. So consideration is given to how historic mistrust of the medical system by the Black community relates to issues of medication adherence and response. So if you've ever heard of the Tuskegee experiment, for example, you would understand where some of this mistrust lies. So the Tuskegee experiment was a study of untreated syphilis in the Negro male in a Negro male control population, and that was conducted between 1932 and 1972 by the United States Public Health Service and the Centers for Disease Control and Prevention. And I think I mentioned there's 400 of these individuals, and there was no evidence that the researchers ever obtained any informed consent from the participants, and the participants were not offered available treatments even after penicillin became widely available. So this study obviously violated basic bioethics at its core, and there was an inherent racism also at its core that drove this practice. So you might think, well, that's in America. What about in Canada? Well, here closer to home, back in the 70s, there were skin graft experiments that were conducted on the Inuit population, also without informed consent. So there's, a number of things that have happened even here in Canada that have added to that mistrust. And I think that's where I'm at. Thank you kindly. I might have one more slide, but I think we got rid of it. Over to you, Nuradiin.
All right. I don't know if I'm on mute. I'm good. Okay. Thank you so much, Bo. That was a very informative part of the whole collaboration, the collaboration that we're doing. I just want to touch base with Ottawa's how it came down to the ACB Mental Health at Ottawa Public Health. Because of the pandemic, we learned so many things, and many of those and all the stuff that came out of the pandemic that surfaced. We wanted to do something about it. Some of that stuff was, a study was done. A report showed that the ACB racialized community having high COVID-19 cases due to the lack of services in the communities that they lived in. And some of those reports helped us to look at, the status of the mental health. Here at Ottawa Public, especially in the mental health department and substance use, we're looking at, mental health being basically the second pandemic that we're going to be going through. So it was only smart to, prepare for it. We believe that mental health and substance use, before the pandemic, the stats that we had, it rised a lot, so how can we prepare, especially for how can we prepare the ACB community? So we came up this, doing a study, seeing, where we at and what can we do. So the hubs idea, that's how we came. Now I'll just give you next slide if you go, please. I'll give you a little background on, what we did to reach that. In June 2018, OPH released the first local mental health surveillance report. Several different local data sources were out of data, so we did not use them. However, the surveillance report that was used was the secondary data from the local data. For example, Ontario Student Drug Use and Health Survey, Canadian Community Health Survey, and the death date from the Ontario Coroner or the Vital Statistics Registry. We used the Emergency Department Department and hospitalization data, neighborhood study and census data. We use those. The limitation of the reports, the limitations of that report were that we did not have access to this. We did not have access to desegregated data from the secondary data sources we used. So it was impossible to share findings based on race, ethnicity, ethnic or immigration status, or sexual orientations. And in our post-report consultations, we heard from many priority groups, included Ottawa's African, Caribbean, and Black community, who expressed concerns that the data presented in the report did not speak to their population, especially in the local context, and therefore they felt they were not included in the data. In our consultation, the community called for primary research to address these gaps, and so OPH, in collaboration with community partners, agencies, delivered the research project to address the lack of presentation in the current data on the strength and the needs of the ACB population, and to explore community-led approach in driven interventions for more effective mental health delivery in this population. If you just go to the next slide. We work with 14 community partners, agencies to implement the research. We held 5 community consultations prior to launching an additional 4 consultations with the ACB leaders so they can influence the recommendations. 130 participated. It was a mixed method study because 100 completed surveys, while 30 participants participated in 1 hour long qualitative questions. And these are the 4 areas we focus on. 1, perception of mental health. What comes to mind when you hear someone has mental illness? Where do those beliefs come from? That's another question. What influences those beliefs? If you needed support with your mental health, would you open to sharing this with your family? And if no, why? Number 2 was protective and risk factors. What impacts your mental health positively? And what are some factors that impact your mental health in a negative way? And number 3, access to services. Tell us about your experience accessing mental health services. What helped and what didn't? What would make your experiences and access to easier? Easier. That was one of the things that we were actually looking into deeper. Number 4, it was interaction with mental health care provider. Would be, do you experience mistreatment or prejudice? What made you feel that way, and what can be done to prevent this from happening? In the next slide, I'll go over briefly the recommendations. Thank you. These are high-level recommendations which were developed in consultation with the community partners over the 4 virtual meetings in May 2020. The recommendations are based on best practices from literature, strategies identified by participants and communities' recommendations for improving the mental health of the ACB community. To organize the recommendations, we use the 4 key pillars from the Mental Health Commission of Canada, which is advancing the mental health strategy for Canada, a framework for action of Mental Health Commission of Canada 2016. The following slide indicates how each of the commission pillars align with the research findings. 1 will be leadership and funding. Structures play an important role in facilitating access to quality care by targeting investments for timely and cultural relevant services, and ensuring collaborations between sectors to remove social and environmental barriers. You're right, if you just stay on this slide, it's good. I'm just going on the first one through. So in addition, equitable presentations in leadership positions is required to make fundings decision aimed at improving access to quality mental health service for ACB communities. Number 2 was promotion and prevention. The promotion of mental health awareness and prevention of factors that contribute to the negative mental health and well-being of the ACB community requires a collaborative approach with the stakeholders from various sectors, including public health. Access and services, this is the 3rd. Recommendation in this area are aimed at improving access to quality and evidence-based mental health services, treatments, and supports that are existing within the community. The specific improvements are required to meet the needs of Ottawa's ACB community. There is a need for greater collaboration, of course, among the healthcare sectors, community agencies, faith-based organizations, education, justice, and correction sectors. Number 4 was the data and research. Although participants to this study did not speak directly to the need for more data and research, it is important to monitor population-level information on mental health and illness and the mental health Canadian Council. So recommendation improving data collection for these purposes. A coordinated approach to mental health research and surveillances will provide enhanced understanding of the ACB community's well-being, access to services and persistent barriers. Currently, there are no protocols, this is the scary part, is that there are no protocols, processes, or systems in place to collect ACB mental health data on an ongoing basis at irregular intervals. This was clear from the recent literature reviews and contributes to our limited understanding of the extent of this issue. The next 3 slides will go over what we have done the past year and the past year and a half since the release of the study. The first one is, we asked when we asked participants where they access mental health services, faith-based centers ranked one of the 3rd top locations people sought mental health support. It was 1, hospitals, 2 was community health centers, and 3 was faith-based centers. From the qualitative portion of the study, faith and spiritual was considered to be an important protective factor for ACB participants in this research, because you are seeking support from someone similar values and belief systems. Faith-based centers and leaders can play an important role in destigmatizing mental health and among their congregation, and addressing many of the barriers to accessing mental health services that diverse and racialized communities face. We have implemented faith leader training in 2021, which provides resources, crisis prevention, provides suicide prevention training to faith-based centers. Any spiritual leader can also participate in this, and we have that on our websites if anybody was interested in. And if you go to the next slide, the second one was the recommendation of the research study that was developed, which was the workplace anti-racism, anti-oppression policies for all sectors, justice, health, education, and child welfare. We work with Yusra, our city anti-racism secretariat, and the diversity and inclusive team to develop OPH's first anti-racism, anti-oppression workplace policy. The policy will help OPH advance the deliverable identified in the Board of Health and Emotion, and to provide a framework that helps us create positive work environment for all of us, for all of its employees and communities. It was approved last fall, and trainings that began for our staff, alongside hiring for hiring of diverse staff into leadership roles, and collecting some social demographic data. We started that, engaging with indigenous and racialized communities. If you go to the next one. So we created what we call ACB Mental Health Substance Use Health Resource List, which is a centralized list. It's a cultural competency surfaced as a consistent theme when research participants were asked what was needed to improve client-centered services delivery for the community. There is a need for service providers who are culturally competent and who reflect to the community. There is also a significant lack of awareness of ACB focus for mental health services. OPH work with local mental health agencies and our partners at Somerset West Community Health Center in creating centralized list of cultural competent mental health services available in the community, and to increase awareness of these mental health resources was released. We released this on Bell Let's Talk Day. If you want to get hold of this list, please go to our website on mental health and COVID-19 webpage, or you could just put it in Google, you will see this. This is the history of what led us to have ACB neighborhood hubs. Now I'll allow my colleague Faqrudin Ali to talk more about the hubs itself. So next.
Awesome. Thank you so much, both of you, Nuradiin and Bo. Nuradiin touched most of the things that we'll be speaking about, but when it came to neighborhood hubs, first of all, my name is Faqrudin Ali. Most of you might know me as, I also go by as Turtle. I'm with the mental health team, started end of December. So one of the things that on my portfolio is to work on the neighborhood hubs. So this is a pilot project that will ensure equitable and safe access to mental health information and support. So we'll just go to the next slide. So as I've said it, it's a pilot project, it's a startup. So this is a place-based approach of integrating mental health and substance use health support within the neighborhoods. And we will directly be working with people living in the area. The hub in the neighborhood have the potential to provide targeted interventions that addresses barriers identified by the community. So that's language, lack of trust, inequitable access to accurate and timely information, mixed messages, misinformations. Due to this, to do that, we will be providing a non-judgmental support and system navigation to residents in that community that will foster community belonging and social connection for marginalized and racialized community, while building trust with leaders within their neighborhood who can facilitate help seeking. This will increase access to long-term and short-term counseling. So in partnership with Upstream Ottawa Mental Health support, community support, we also partner up with Ottawa Public Health, the City of Ottawa Social Service Department, Access MHA, Counseling Connect, Access One Call, One Click. So we will be working with all of those partners. So that's what was established. So now we look into why this came about. So if we just go to the next one, it will say why. So significant of health inequities have been well documented among racialized and ACB community. Emergent evidence show that many of racialized groups are at risk for poor mental health and social and development of a mental illness. So discrimination, stigma, language barrier, socioeconomic disadvantage have been shown to have a direct impact on mental health. Recent studies show that living in a racist environment increases the risk of illness for racialized group. So Nuradiin touched a little bit on the status of mental health in Ottawa, but some of the surveillance revealed that individuals living in less disadvantaged neighborhoods have more than twice the rate of emergency department visits for mental health and addiction. So those who live in a low income reported lower self-rate mental health, happiness, life satisfaction. They are 3 times more likely to report food insecurity, more than and more often talk to health professional about mental health. So also those with lower level of education reported lower self-rate mental health and life satisfaction and psychological well-being. Also, it is determined that children who live in lower socioeconomic neighborhoods are at a greater risk for poor development. So when we look at the mental health of Black communities, research has revealed that, as Nuradiin said, one of the most frequently mentioned is going to faith-based. So talking to religious area, and in others, barriers to accessing mental health service included cost. It was reported 66%. A provider not understanding one's need, 57%. A long time wait, that was 49%. An inconvenience of the location, so not accessible to them. Also revealing that in the mental health during COVID-19, it revealed that people who are visible minority and racialized were more likely to concern about burnout compared to non-racialized population. Also higher stress compared to people not identified as minority or racialized. Also was the concern about loss of support compared to those who identified as not racialized. 1/4 of Ottawa residents who wanted mental health support did not know where to turn, compared to 40% of those who identify as visible minority and racialized. So communities that faces systemic oppression, experiences inequitable access to environment support, supportive of health, which contributes to increased risk for mental illness, substance use disorder, overdose. So addressing the stigma experienced by people who use a substance and that have mental illness is also a key component of the approach, because we know that the inability to access supportive environment and resources can be component when a person experiences a stigma and faces discrimination. Therefore, attention to diverse needs of different population and neighborhoods is required in advancing work on mental health and substance use. A public health approach recognizes the intersectional systemic change to the accomplished with population facing barriers. So that was why we put this together for the neighborhoods. And then how are we, when we go to the next slide, it's how are we going to execute this? So some of the things that we've done, Ottawa Public Health and with the Ottawa Public Health with the mental health and substance use team, we've trained community engagement team and the immunization staff on a person first language to increase the awareness of the impact on stigma and tips and strategy to reduce stigma. Alongside many of the barriers faced by our community, stigma is a significant barrier because it prevents people from discussing their condition and from seeking help when they need to. So using person-centered language to talk about mental illness ensures that the person is seen as a person first and not as their illness. So we will be providing stigma resources. The second thing is we will be working with organizational in the neighborhood. So we'll build in extended partners that we'll be working with and collaborating with. And the third is bringing Upstream to do workshops and counseling in the community and working with LACAP as well. So, and then the fourth thing is that we will be picking 4 locations in the neighborhood so that any access to questions or we can assist them or help them, residents with navigating mental health and services as appropriate. So, and then, so now we'll look at the locations. So when we go to the next slide for locations, we've picked right now 4 locations as of right now. So we will be at Albion Hetherington, we will be at Bellevue Community Center in Caldwell, Rideau Rockcliffe Community Center, and also Foster Farm. Also today we had a meeting with the Boys and Girls Club, so we might be getting more locations to come along. So those are the 4 locations that we picked as of right now. And then the next slide we'll go to is just resources and informations. So Ottawa Public Health created and maintained the city mental health and COVID-19 webpage to support residents with resources, coping strategies, employer handouts, family handouts, toolkits, direct link to counseling and crisis services for various audience. That's from youth, young adults, parents, older adults, workplace, indigenous population, diverse population, those living with substance use disorder and violence. So this was created and maintained the Protecting Your Mental Health series in partnership with Royal Ottawa Mental Health. This was developed to support positive coping strategies and to promote positive mental health for all Ottawa residents. So these are websites that anyone can go and access and resources that are available to anyone in Ottawa. Okay, and last but not least, that's the conclusion to my presentation. So if you have any questions, hopefully we have 10 minutes, so hopefully we'll get through any questions that you guys might have. Thank you. Let's not be shy, feel free.
We have a question from Javier.
Yeah.
Thank you both. Thank you. Great to see both Total and Nuradiin today. Thank you for the presentation. As for the hubs, do you have the operating times and the schedule? How do you have particular day when have they started operating already? Do you have a particular launch date? Thank you.
So it's a great question, Javier. We haven't started yet. We're still in the process. So hopefully the goal is to start end of March. So hopefully we'll finalize everything, have a poster, everything ready to go end of March. That's the goal.
Thank you. I'll be happy to promote it widely in our neighborhoods. Thank you.
Amazing. Thank you, Javier. Hi, Tammy. You're on mute.
Hi, Turtle. Nice to see you. Nice to see you, Nuradiin. And nice to meet you, Bo. I've heard so much about you. So this was a really great presentation and very excited to see these hubs rolling out. They're so needed in the community. And ACB is essential. Quick question about how long the pilot project is going to run for.
So right now, we're hoping it's just a pilot project. So we're hoping 5 to 6 months, but our goal is to continue and be a consistent in the community. So we're hoping to get as many foot traffic in there as possible and to be there for a long time, and so that the neighborhood can access anything that they need. So that's why we're partnered up with Upstream and to be there. So it's a start, but we're hoping to be there for a long time.
May I ask just another question too? I'm just wondering if how will you measure the impact in terms of the outcomes that you're wanting to achieve?
So right now it's by interaction. So communicating, plus we worked on a toolkit for evaluation. So we'll look into that and work with that and our surveys as well. So, but the interaction is what we're trying to capture at the moment.
So just
sorry.
To build on that, we'll have a full clinical suite of tools we'll be applying and the metrics that we will be, I guess, collecting as part of our interactions with those we seek for the Sophisti program that we're serving through the Sophisti program. We'll be able to add that data set to the evaluation piece.
It's great. I look forward to seeing the impact this is going to have, and it's so important. I think about I work for the Community Development Framework, which is place-based support in neighborhoods, and this is so important. So I just also think about potentially the role that partners can play. For example, I know you have Rita Rockcliffe Community Resource Center and Foster Farm, those locations. And I'm just thinking of any other neighborhood based partners that might be able to help with outreach, promoting what you're doing, and or seeing what they're saying in terms of the impact.
That's the key. I just wanted to explain a little bit about also, we have 4 locations for now. That's our capability for now. It is a pilot project, but the goal is to have these things in place, these hubs in place, because of what we learned from the past, and we ended up having, clinics for vaccination or testing clinics at locations where had no services, and we saw how well it worked, and now why wait? We have to put this in place now, these mental health services now. So how is it going to be done? What we did was we have 4. 2 of them will have ACB. 2 of them will have ACB resources. Someone from the ACB community or organization from the ACB community will be there, like whether it's for peer support, whether it's for social worker who is from the ACB community, will be available to the people that they want to go. So the one that in the East Rockcliffe is more francophone. So the francophone community could be there. and the one in the West is more Anglophone. So it works out best for us. That's a start. Nobody said, like today, Turtle, sorry, I called you Turtle, Faqrudin, said that, today we had a meeting with Boys and Girls Club, and they're open to have facilities, all their facilities, all the Boys and Girls Club in Ottawa, they're on board. That's more facilities. So now let's say that, Somerset West wants to be on board and they want to have somewhere closer to their area. Well, guess what? We're going to open up a hub. We're going to be there. We want to expand. No one is reducing this, but the idea of having, a place where people could access and get resources so that they're not left behind is the key. So we're bringing anything related to mental health, substance use health, anything related to the work that we're doing all over, and all our partners could come and support in whichever area they can support at these hubs. However, though, if someone comes and sees a social worker from Upstream or a counselor from Upstream, that's their privacy. That counselor will always come to that location to meet with, with that person that they met, and they keep their file. That's the work between them and that person. And that's just creating that connection is what we're doing the hubs for. So I hope that helps better.
Yes, it's wonderful. I'm glad to hear that you're thinking long term, and I think it's really exciting what you're doing. It's so needed. And we have the community development framework where we and Turtle and Nuradiin, Faqrudin, and Nuradiin are a member of our working group that's looking at place-based community development approaches to mental health with a focus on equity. And right now we're developing a family neighborhood strategy for Black racialized newcomers. And I think this fits really well, where we could look at how do we support what you're doing, and as you say, look at other potential locations. So I think this might be a really important key component to the work that we're trying to do. So I'd really welcome an opportunity to talk more about that. That's wonderful. Thank you so much for all your work on this.
We'll be in touch.
Please do. I look forward to it. Thanks
We'll
so
meet,
much.
Tammy. We'll meet up.
We'll meet up.
That's amazing. And in the chat, Christina from our team put in the mental health report on the website, so you guys can go to that link and check it out as well. So the mental health of Ottawa Black Community Report. So thank you, Christina.
And Nuradiin, you may want to type your email into the chat just so people can have it if they so desire.
I put my email there already, so did Denali. And thank you, Bo. You have your email there too.
So we've nailed it. We've got to 2 minutes before the hour. Love to have any more questions if anybody has them. Please feel free to type it in the chat box. Sounds like we've got a lot of interest and support behind this, which is awesome. I think that it's a little bit like drinking through a fire hose that we want to start, and the demand is going to definitely be something we're going to have to figure out how to meet it. But that's going to be part of our process. But there's definitely a desire to meet the demand because it's been a population that's been so underserved for so long. Kind of almost in my head, I'm thinking we're doing this in 2022. Like, you thought this would been done in the 80s or something, but so it is, right? And better late than ever sort of approach. So I'm looking forward to getting underway.
So just to be clear, sorry, Bo.
Yeah.
Go ahead. Sorry, I think I cut you off.
Okay,
good. Just to be clear, the hubs is only 2 locations will be focusing on. We'll have ACB services. The rest is for racialized communities and anybody else who comes in. Ottawa Public Health or us, we don't reject anybody for any other reason. It's open to all Ottawa public. But we do have services for racialized community. We do have 2 of the locations will have even ACB, will have an ACB lenses. Basically, let's just say that. So 2 of the locations. So yeah, I just wanted to clarify that. And I'd like to also just mention that we are part of the Black Ottawa Public Health is part of the Black Mental Health Coalition. So it's Upstream. So we do have a coalition that that supports all this work. and it is growing, and we will have even more and more resources from all the agencies part of the coalition in the future. Appreciate it.
Great. Thank you very much, everybody.
Thank you, everybody. Appreciate you all.
Thank you guys so much for taking the time.
Have a great
Thank
day.
you.
You.
Okay, so that went well.
Hi, Sharon.
Yes.
I see that you stayed around. I got your text. You have my email. I sent it to you.
Yes.